Director of Congressional Relations for the Heritage Foundation. I'm going to start with you, Tommy, and dispense with this idea of just repealing altogether Obamacare, because that would send the entire market into chaos, right?
I don't think so. I think the markets would respond the way that we expect a free market to respond. We know that free markets bring competition between firms. When they're competing for your business, they're going to offer a better product at a lower price. Part of the reasons premiums have gone up so high is because of Obamacare. I expect premiums to get a lot cheaper if Obamacare were to be repealed. I think what we're seeing from the president with that tweet, with his statement that if repeal and replace doesn't happen, he's still committed to keeping his campaign promise. President Trump is absolutely committed to keeping that promise and all of his campaign promises. But no, I don't think that we should expect the insurance markets to collapse if Republicans did what they say they're going to do.
If there was a robust market to insure the people who were added to in the insurance rolls under the Medicaid expansion, these are basically the working poor, people at 125% of the poverty rate. If there was such a robust market to offer them insurance, then why wasn't it there before Obamacare?
Well, if we're speaking about those people on Medicaid, the CBO assumes some of them would leave Medicaid, but Medicaid is free, so they're required to be on it under Obamacare, and the CBO assumed some of them would leave, despite the fact that it doesn't cost them anything.
No, not leave, lose their, no, I'm sorry, they would not leave. This is not people voluntarily saying, you know what, I choose to go uninsured. It's people losing their health insurance, essentially not having health insurance anymore. I want to get into
under the Senate bill, nobody
under the Senate bill, they would lose. 22 million people would lose their health insurance. The bulk of that would be because of cuts to Medicaid. I want to go specifically into it because I want to make sure that people really understand it. Because there are two different buckets of insured. There are about 10 million people who buy in the non-group market. That's who you and the Republicans are legislating for. Just them. The 10 million people who buy insurance under Obamacare. So if we talk about those people, the new bill that the Republicans are proposing would essentially force, this is a great piece that the NBC News did a great analysis of this, and it essentially said the bill would require people to pay higher premiums, this is the non-group people, to buy a private plan that's similar to what's already under Obamacare. So they'd have to pay higher premiums to get what they get under Obamacare now. And then it would reduce spending on the subsidies and distribute them in a way that encourages people to instead purchase a high deductible plan with lower premiums. So people who would get lower premiums would just be stuck with a high deductible plan. You think that's better?
No, not in that specific case.
That is for the non-group market. That's what would happen.
Well, the CBO said late this week that this bill would actually drive the cost of premiums down by about 30%.
For people who are getting right, they would drive the cost of premiums down for people who were then pushed into high deductible plans. You pay a lower premium, but when it comes time to use your insurance, you're paying a much higher deductible. Right. That's exactly what the CBO said.
What those people are going to have under the Senate bill is more choice. We know that when they have more choices, they're going to exercise that choice, and that's going to affect the behavior.
That's a great bumper sticker. That's a great bumper sticker, because remember, we're still only talking about the non-group market. Hold on, but you're basically saying that if people can buy more junk insurance, insurance that really doesn't cover much, insurance that has low premiums but doesn't cover you when you're sick,
insurance that covers the things they want,
that are basic things, and most people like the services that they're getting under Obamacare, the free mammograms, et cetera.
I think most people want to pick the services they get, not have the federal government
pick them for them. Would they also want to pick to be uninsured? Because you guys keep on saying that people would voluntarily disenroll from insurance, and there's no. Would you voluntarily disenroll from insurance?
I didn't say that. The CBO said that.
No, the CBO didn't say that. It said they would lose their insurance. It said very specifically they would lose their insurance.
They said a few million would volunteer
their insurance. And the only people who would voluntarily disenroll, and the only people who actually, again, get lower premiums, are people who don't want to pay the penalty under Obamacare and therefore disenroll because they didn't want to buy insurance. That's a tiny fraction of the American people. It's of that 10 million, you're talking about maybe a couple of million people. And then it also says at the same time that when you take away the subsidies from people, low-income seniors will be hurt the most. This is what the CBO also, hold on, the biggest spikes in uninsurance, and I'm just saying what the CBO said, the biggest spikes in uninsurance come for older, low-income customers who would also have the hardest time finding affordable insurance. What do you think?
Well, look, if we're talking about the CBO, let's just think about how they did predicting how much Obamacare would cost.
Answer my question. We don't have time to talk about the CBO's methods. Do you think that it is a valuable trade-off to have lower-income people, the oldest and lowest-income people, have the hardest time finding insurance and be the most likely, the biggest spikes in losing their insurance?
No,
Do you think
but
that's
I don't
a fair
think that will
trade-off?
happen under the Senate
That's
bill.
what the CBO says will happen.
And I don't believe them. And
Okay,
I
let's
don't
go to
think
Jonathan
anybody
Cohn.
should, given their track record.
Why shouldn't they? Because they were spot on in the number of people who would get insurance. They had a different mix because they assumed that states.
Yes,
they
were incredibly wrong
no,
about
they
it.
were
They
not
were wrong about how much it would cost and who would be
they
insured.
They were not. Health costs have gone down, and the number of people overall that got
Health
insurance were
costs have
correct.
not gone
the
down.
Mix
They've
of who
increased.
got